Hey, it's Dr. Scott from Chiropractic Associates in Long Grove, Illinois. Have you ever seen one of those social media posts that says, "How old were you when you learned something silly like how to use the gadget on, your favorite creamer or a unique way to clean or open something?" I had that happen the other day. I was listening to a podcast, and truth be told, I was 54 years old before I learned something really important that I discuss on a regular basis in the chiropractic office. So let's look at the topic, and then I'll show you the one that I was surprised by. Are there any problems with epidurals? So many times people have back pain and they're told by their family doctor or someone else, "Oh, you need to hurry up and get an epidural." Well, they forget about the potential problems for epidurals. The first problem is that the FDA has not approved epidurals for injections into the subdural space. I was 54 years old before I realized that, and I've been in practice for 20 some years, and I didn't know that. So epidurals are not FDA approved. They're being used off secondhand market or whatever they call those, off label, to help people with radicular pain down their leg. The second thing you've got to understand about epidurals is it does nothing to improve movement or function. It doesn't improve flexibility. It doesn't make you any stronger. The structural situation there is not aided in any way by an epidural. All we're trying to do is soak the area that might be inflamed with an anti-inflammatory, a corticosteroid, in hopes that that will provide the patient some relief. And then the third problem with epidurals is that it can actually degrade the bone health by as much as 20%. You probably saw a little bit about that a few years ago, that epidurals can create a localized osteoporosis. And if we use them frequently, we're actually weakening the bone, which means the bone has an increased chance of fracturing at a later date. So I was 54 years old before I learned that the FDA has yet to approve epidurals for use in the epidural space. If you're having back pain and looking for some stronger answers and maybe some alternatives to things like epidurals, give us a call at Chiropractic Associates in Long Grove, Illinois. I'm Dr. Scott, and we'd be happy to be of assistance.